I'm gathering my equipment, washing my hands, providing for privacy. Hi, my name's Allie. I'm the nursing student here today. Could you verify your name and date of birth for me?
Madeline Roser, 1/7/2005.
All right, and today I'm going to be doing a wound dressing change. Do you have any questions about that?
I do not.
All right, so they do not need further education about the abdominal wound dressing that I'll be doing today. And I'm making sure that the patient is safe, bed's in the lowest position, call light, non-skid footwear, side rails, and I'm making sure that the patient is in a comfortable position, seeing if I need to move them for the dressing change. Could you tell me a little bit about your pain today?
I don't really have any pain today.
Okay, so no pain is noted. And then I'm going to start gathering my gloves. All right, I'm gonna open my equipment up all at once. Making sure this is on the bedside all together. All right, once all the equipment is gathered, I'm then gonna start uncovering the area. All right, and I'm gonna loosen the edges with the push-pull method. Once the edges are loosened, then I'm gonna grab from the middle and dispose of this. Check if there's any like drainage or anything on that. And then I'm going to take out carefully the packing and dispose and assess that as well. And then when I'm looking at the wound, I'm gonna look if there's any different types of like pus or fluids coming out of it, if there's any tunnels, and then I'm gonna like smell if there's any different smells. And I'm seeing that it's the inside of the wound bed is beefy red, and it's growing, or it's going back together pretty well, and I'm not seeing any like death or tissue death or anything. And then the edges are pink and it's a little bit inflamed, which is kind of normal for this situation, so not something to be concerned about. I'm then going to measure the length, which is 14 centimeters, and the widest part, which is 3 centimeters, times width. And then for depth, in the deepest part, and that is about 3 centimeters as well, and that would be disposed of. I'm then going to get a new pair of gloves. The new gloves on, I'm having the saline poured in here, making sure it's damp, and I'm bringing this over to clean. All right, then I'm just going to kind of squeeze that so it's not too wet. And then dispose. 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 And then dispose. And we're done with that. We're then gonna make sure the outside of it is dry. So dab. Dispose. And you can also pack this to get the extra moisture. Alright, once it's all clean, then I'm gonna take my equipment and I'm gonna put a new pair of gloves on for that. Also washing hands after I put each new pair of gloves on. Alright, once these gloves are on and I have the rest of my equipment for the procedure, then I'm going to start putting 4x4. That's a clean stick. And then start packing it, making sure it's not too tightly packed, but not like loose. All right, disposing. And once that's packed, then I'm gonna put on another pair of gloves to wash my hands. And then I'm gonna be taking the cover and I'm gonna be measuring and putting it on the correct area. And when putting it on the pubic area, making sure that it's not directly on the pubes so it doesn't rip them when changing again. All right. All right, then I'm changing my gloves again and with washing hands, and then I'm going to sign my initials, date, and time in military time. All right, once everything is done, then I'm going to remove my gloves again, ask if there's any questions, and we'll be back to check on you and let us know if you have any other questions. Thank you.